Establishing expert-based recommendations for the conservative management of pregnancy-related diastasis rectus abdominis, a Delphi consensus study. Hi, I'm Sinead Dufour. I'm a professor at McMaster University in Canada and also the director for pelvic health at the World of My Baby, the Womb, which is a perinatal care center here in Canada. I co-led this work with Stephanie Bernard from Laval University in Canada. So, why was it important to do this work? Currently, the scientific literature remains to be lacking in terms of giving us clear guidance for our practice where diastasis is concerned, and this is despite the presence of a number of controlled trials at this point. We have discordant perspectives observed in the gray literature, and ultimately a lot of confusion among providers and healthcare consumers alike. The American Physical Therapy Association did acknowledge the significance of this work, as in 2018 we were awarded with the Elaine Meadows Research Scholar Award from the section on women's health. This work also led to some really important collaborations with other leaders on this topic globally. The study was the first of its kind. We used an innovative approach with our Delphi consensus methodology, really acknowledging that practitioners' clinical expertise do characterize one of the three pillars of evidence-based medicine, and there certainly is an acknowledged value of involving the end user in the research process. So we wanted to actually marry practice-based research given the current gaps in the literature. With the recommendations that were developed, some were discordant from the current literature and some were concordant. But an overriding theme was the fact that we have to start looking at impairments of the linea alba from a more global perspective, integrating the pelvis and the thorax and all of those systems. It is important to acknowledge that the recommendations developed in this consensus work really are principles only. All of these principles or recommendations have to be tested in appropriate study designs to determine if they're actually effective or clinically relevant and appropriate. And also, future work really does need to look at habitual behavior strategies as well as expanded aspects of assessment for diastasis. This was something that really came out of this work, and currently myself and Stephanie Bernard do have some studies underway. In addition, what came out of this study was really the need to look at the exercise interventions that have been done and studied, and looking more carefully at how are these exercises being done rather than just what's being done, and also looking at when are these interventions being done? There's certainly a lot of different factors at play in the early postpartum period, what we call a critical healing period, versus maybe the first year postpartum where breastfeeding might be impacting connective tissue versus beyond. And so really looking at the timing of interventions so we have a better sense of what interventions are appropriate at what time. Questions related to this work or some of the other work that I mentioned can be directed to me, Sinead Dufour, at sdufour@mcmaster.ca.